Hello, everyone. Today, we're diving into a topic that affects us all: nutrition and its profound impact on our health. We'll be exploring the insights from the book, Doctor, What Should I Eat? Nutrition Prescriptions for Ailments, in which diet can really make a difference, by Dr. Isadore Rosenfeld. This book is not your typical eat this, not that guide. Dr. Rosenfeld, a distinguished medical nutritionist and professor at Cornell University Medical College, takes a refreshingly different approach. He emphasizes that proper medical care should include advice on the right foods to eat, not just medication. After all, almost every major medical condition is either caused or affected by what we eat. Think about it: ulcers, kidney problems, anemia, asthma, heart disease, diabetes. You name it. The right diet can help, while the wrong one can hurt. But here's the catch. Most doctors aren't comfortable with nutrition. They didn't study it in medical school, and the system often punishes them for spending time on it. Insurance companies reimburse doctors for quick procedures, not for the time spent explaining the importance of nutrition. So, what happens? Patients are left to fend for themselves, often turning to self-styled authorities with questionable credentials. But fear not. Dr. Rosenfeld is here to bridge the gap. He collaborated with registered dietitian Sandra Pressman to create a comprehensive guide that spells out exactly what you should and shouldn't eat for over 70 common disorders. Let's take a closer look at some of the key insights from the book. First up, acne. Remember those frustrating teenage years with pimples popping up at the worst times? Dr. Rosenfeld acknowledges that genes and hormones play a role, but he also explores the possibility that diet might influence acne. While most physicians have abandoned the dietary approach, some patients insist that certain foods like chocolate, milk, and fatty foods worsen their acne. Dr. Rosenfeld suggests that if you believe a particular food aggravates your acne, avoid it. After all, you're the best judge of what affects your body. Now let's talk about Alzheimer's disease. Dr. Rosenfeld emphasizes that Alzheimer's is not a natural part of aging, it's a disease. And while there's no proven prevention or cure, he explores the potential benefits of nutrition. For instance, he mentions that postmenopausal women taking estrogen replacement therapy may reduce their risk of Alzheimer's. He also discusses the role of antioxidants like vitamin E and the controversial aluminum hypothesis, which suggests that aluminum exposure might be linked to the disease. Speaking of antioxidants, Dr. Rosenfeld delves into their role in preventing cataracts. He cites a study of female nurses that found those who took supplemental vitamin C daily for at least 10 years had a 45% lower incidence of cataracts. He recommends consuming plenty of vitamin C-rich foods like citrus fruits and leafy greens throughout life. And for those who smoke, he has a clear message: quit. Smoking is a major risk factor for cataracts and many other health issues. Dr. Rosenfeld acknowledges the ongoing debate about vitamin C's effectiveness in treating colds. While some studies claim it can shorten the duration and severity of symptoms, others conclude it's ineffective. He suggests getting extra vitamin C from food rather than supplements, as the latter can cause diarrhea in large doses. He also points out that chili peppers may relieve nasal stuffiness, and chicken soup, a favorite of grandmothers everywhere, has been shown to stop the migration of white blood cells to the respiratory passages, potentially easing cold symptoms. Now let's shift gears to arthritis. Dr. Rosenfeld explores the role of diet in managing osteoarthritis and rheumatoid arthritis. While he couldn't find a single medical textbook that recommends dietary changes for these conditions, he did uncover some interesting leads. For instance, a fatty acid extracted from seed oil made from evening primrose and borage herbs has been shown to benefit people with rheumatoid arthritis. He also discusses the potential benefits of omega-3 fatty acids found in cold water fish like sardines, tuna, and salmon. Finally, let's tackle diabetes. Dr. Rosenfeld explains that diabetes is not a single disease. There are different types, and the treatment varies. He emphasizes the importance of maintaining blood sugar levels as close to normal as possible to prevent long-term complications. He also discusses the changing views on carbohydrates, noting that the American Diabetes Association now allows moderate amounts of monounsaturated fats and has relaxed the ban on simple sugars. So, there you have it, folks. A whirlwind tour of some of the key insights from Dr. What Should I Eat? Dr. Rosenfeld's book is a treasure trove of information, offering practical advice on how to use nutrition to manage and prevent various health conditions. Remember, the key is to work with your doctor and a nutritionist to develop a personalized eating plan that works for you. Thank you for tuning in to BrightLearn. If you enjoyed this episode, be sure to subscribe and leave us a review. And don't forget to check out Dr. Rosenfeld's book for more in-depth information. Until next time, stay healthy and keep learning.
Visit brightlearn.ai for more fascinating videos like this one, and naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.